Thank you and good morning. I'm delighted to bring greetings from the other coast. I am from Oregon, and I echo everything that's been said by Elizabeth and Harold and Jim to date. You know, out in Oregon, we kind of consider ourselves to be the real pioneers. We also consider ourselves to be real pioneers when it comes to healthcare. If you don't know, we have a governor who used to be a physician in the emergency department and who's very fond of trying to really make transformation happen in really innovative and different ways. So we are living that test laboratory on a minute-by-minute basis in Oregon, and delighted to share a little bit of our story with you today. I've been asked to focus on a particular area, as Harold said, of utilization measures for providers. So I'm going to just take you through a little bit of background about who we are, what we're doing in Oregon, and focus in just ever so briefly on these utilization measures. Consistent with the others for NRHI groups, we are a nonprofit. Our mission is totally focused on improving quality and affordability for all Oregonians. We do that through the multi-stakeholder collaborative process. We've been around since 2000. We have over 150 volunteers who participate in 11 different subcommittees. We do our work by leading collaborations, by producing unbiased quality information, and we're using that data power, as Harold mentioned, to really try to provide all of the individuals in Oregon who are trying to transform care with the information that they need to do that. As Jim mentioned too, our foundation and how we do that is by building this data warehouse. We have a provider directory that has most of the providers who are providing primary care in Oregon, over 80%, mapped to a physical address, which becomes really critical when you're trying to do this work. We are statewide throughout Oregon, and this shows all the providers that we have in that directory. We have 3.2 million unique individuals. If for those of you who might know right off the hand what the population of Oregon is, it's 3.8. So that's a lot in terms of where we are. We also have over 700,000 unique providers in that database. How does that look if you look at payers? We have over 75% of the commercial population, 71% of Medicaid, and we have 38% of Medicare. We are thrilled because we're one of the first entities to become a qualified entity, which means we'll get Medicare fee-for-service later this year to be able to put in the mix of our data. Our utilization measures can be found by providers on a secure portal. They are able to do that after they've signed the necessary legal agreements. And much like Jim, we started with measures that focused on adults and on chronic disease and also on prevention. We've moved to utilization measures in the middle, and this year we've actually added avoidable ED visits and hospital admissions. When a provider goes into the portal, they can look at this information, and the part that's really unique is that they can see patient-level detail. So not only can they see their results, but they can actually see which of their patients from all the providers that contribute data are actually attributed to these measures. So I know if you have middle-aged eyes like mine, you probably can't see a lot here, but just suffice to say, the measures are down the left side. Across the grid on the right, a provider can see how did they do compared to their peers in the clinic, how did they do compared to the Oregon benchmark, how did they do compared to the HEDIS benchmark, and if they click on the highlighted areas, they actually get to see the patients that are attributed to that measure. So they can use this for a registry and for quality improvement. An example of a utilization measure that's been accepted and people are very enthusiastic about it is the avoidable ED visits. Again, a provider can log on, see which of their patients were in the emergency department, what was the date, what was the facility, and was it avoidable or not. And that information is aggregated on most of their patients. They can look at inpatient admissions, they can look at top pharmacy prescriptions in terms of drugs that were prescribed, they can look at imaging services, they can look at specialty visits, and they can actually download that information and use it for improvement. Everybody always wants to know, does anybody care? Is anybody looking at this information? We like to say yes. If you see on the right, the last release of data, we had over 140,000 hits on the website for providers, so a lot of people are using this, and you're seeing it's increasing over time. This is our consumer website, our statewide report. This is another slice of the data for those avoidable emergency department visits. We broke this out by payers, so you can see commercial versus Medicaid versus Medicare. One of the most striking things, if you're covered by Medicaid and you're a child in Oregon, you're twice as likely to land up in the ER for an avoidable ED visit, which is a striking number. We break this all the way back down by geography, by plan, by provider, so people can actually try to work on this. If you look at potentially avoidable hospital admissions, we use AHRQ's ambulatory sensitive condition measure for this, and a huge variation if you look across the top for the comparison of commercial Medicaid and Medicare, 407 per 100,000 rate versus 3,795 for Medicaid versus 6,442 for Medicare. Huge variation. Again, broken out, this is just a slice. If you look at that across the state, the green shading here shows the difference in counties. So the grades of green on this slide show from low to high. It's a six-fold difference from the county that has the fewest admissions at 786 to the highest, which is over 5,000. So why is that? So we're plotting hospitals and critical access hospitals and what's going on with primary care access and able to try to work on this issue, which is huge. So just to tie it back up in terms of what are we doing with these utilization measures and how are others using them? If you don't know it, we're in the middle of a huge implementation for Medicaid on community care organizations, where communities are being asked to provide integrated care for both health and mental health benefits. Utilization measures are going to be part of the incentive pool. They're going to be part of what everybody's looking and what's public. We're helping to provide that measurement and that validation. As Jim mentioned, the Oregon Health Insurance Exchange, we're providing the metrics for that, which include utilization measures. And to Harold's earlier point, the explosion of ACOs and commercial activities in the state is really resulting in a lot of interest in utilization measures at all levels in terms of working on improved both care and also cost. One project that we've just about wrapped up at 2 years is the Oregon Health Leadership Council project. We've actually been providing quarterly utilization reports on the secure portal. It's a case management program, and the results of that aren't in yet because they're going to be independently evaluated, but they're seeing some very impressive reductions in hospitalizations and also ER visits that hopefully that study will be able to summarize and share for learnings. And then lastly, Harold mentioned primary care, the initiative from CMS. We're very excited because it's a possibility that we may be able to use some of these utilization measures in the aggregation. So just to wrap things up, the future is bright. There's lots going on. We're very excited about the opportunity to really use this kind of data in all kinds of different ways. We're interested in aggregating EMR data and claims data. We're excited about new fee-for-service data from Medicare. And I think the most exciting thing about today is the opportunity. You know, we get together and we love sharing the pioneering that's going on in NRHI communities. We know that each of you are pioneering in your own right, in your own views, and we're delighted to have this opportunity today to collaborate with you and pioneer together across the country. Thank you very much.